So next is Dr. Gariyashee, who is presenting on ocular blood flow as preclinical marker in diabetic retinopathy.
Good morning, everyone.
Slides. Yeah.
I am Dr. Gariyashee, and I shall be presenting before you the topic ocular blood flow as a preclinical marker in diabetic retinopathy. So in the early 2000s, we have noticed several studies which investigated the relation of ocular blood flow with different eye diseases. Similarly, we have conducted a study to establish any correlation between diabetic retinopathy, which basically affects the retinal microvasculature, along with the retrobulbar circulation. So the main aim of the study was to assess the parameters in the retrobulbar vessels using a non-invasive technique that is color Doppler imaging. And we would reassess the parameters after a period of 6 months and try to establish if there is a correlation with the progression of the disease. So this was a hospital-based observational study conducted in a medical college in Assam, where we had taken 120 diabetic patients more than 40 years of age with or without retinopathy who were willing to participate in the study. However, patients who were metabolically unstable such that they are not able to follow up for the subsequent visits, or they have any disease or vascular anomaly of the eye, history of trauma, or any other significant media opacities that precluded the fundus examination were excluded from the study. Briefly about the methodology, all the patients more than 40 years of age were recruited. A detailed history was taken, clinical examination was done, and a dilated fundus examination along with a digital fundus photo was documented for each and every patient. The patients were then classified according to the International Disease Severity Scale, and also they were subjected to color Doppler imaging where different parameters were assessed. So here we can see on the right hand side we have the digital fundus photographs, and on the left hand side we can see the color Doppler imaging. This is a very easy, less time consuming and affordable test where we can assess the parameters, and we can see different parameters on the left hand side, including the peak systolic velocity and diastolic velocity, the resistivity index and the pulsatility index. However, in the study only the resistivity index was significant, so we'll be discussing only on that. Coming to the results, 120 patients were included, majority of them were males, and most of the patients had a duration of diabetes for more than 13 years. Most of them had moderate NPDR changes. So what we found was in the ophthalmic artery as well as the central retinal artery, we can see a significant increase in the resistivity index. These values were compared over a period of 6 months. So we have seen similar articles in the literature where we have seen Dimitrova had also studied 18 patients for 21 months, but he could not establish any significant alteration. But we have seen significant increase in the resistivity indexes in the central retinal artery by a study conducted by Sood et al. And there is only one long-term study in this field conducted by Neudorfer M, where he has seen significant increase in the RI in the ophthalmic artery. However, the study has several limitations, which is a small sample size, and the follow-up period is very small to establish progression of diabetic retinopathy, to establish a correlation. The main idea of presenting this presentation here is to garner the audience so that this can be conducted across large population and different healthcare settings, and hopefully in the future we can also have a non-invasive, affordable technique as a regular checkup for diabetic retinopathy. Thank you so much. These are my references.
My dear, progression of diabetes is
ma'am.
not only due to the glycemic index.
Yes,
Actually, other comorbidities, dyslipidemia and everything there.
Yes,
so have
ma'am.
you accounted for this?
No, ma'am. It was only the progression here was defined as increase in the grading or increase in the next progression to the next grade, or at all in the same grade but more clinical presentation. That is how it was taken account.
It was only these patients were of simple diabetes, having nothing like the cholesterol or anything.
Those systemic associations were not
undertaken.
Yes, ma'am, undertaken.
This color Doppler was used the same ordinary machine or any additional?
So that was a ordinary Samsung ordinary ultrasound machine using the 15 megahertz transducer. Only we had to use the color Doppler mode, and the parameters will be automatically reflected.
adapter or
No,
no,
nothing, sir.
nothing.
So it would cost around 800 for the patient.
It was done by ophthalmology department or
Radiology.
radiology department?
I took help of radiologist, ma'am.
Okay.
Development of macular edema was considered as a progression, or
No, sir. Any change to the next grade of
just degree
diabetic
of,
retinopathy, or even within the same group with more hemorrhages or more symptoms, but not accounting to the next group, were considered as progression.
did you
sir.
compare the two eyes and difference between the
No, sir.
progression?
Only
into
the one eye was taken, which had severe presentation. Only that eye was taken, sir.
Yeah.
Next one we can call.
Yeah. Thank you.
Thank you.